Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health Program. Today's topic is breast cancer. Although it is uncommon in men, but it is very important and common among women. And we have invited Dr. Amber Guth, who is board certified in general surgery and specializing in breast surgery, and she's associate professor at NYU. Dr. Guth, welcome to our program.
Thank you, it's my pleasure.
It's a common problem and important problem. Recent recommendations have changed about breast cancer. How common is breast cancer?
So breast cancer is the most common cancer we see in women in the United States. More common than lung cancer, although more women die of lung cancer than breast cancer.
But the breast cancer is more than the lung cancer.
That's right, much more common. About 250,000 new cases per year are diagnosed in the United States, and about 40,000 women die of breast cancer.
So most of the diagnosis is made obviously with the mammogram.
Yes, in the United States, probably 2/3 to 3/4 of all diagnoses are made mammographically.
Right. And recently, the Cancer Society has changed the recommendations when women should go for mammogram. Can we go over that a little bit?
Oh yes, well that's a very controversial point, and the recommendations for many years had been to undergo routine mammography starting at age 40 and do it yearly until the woman decided not to or had other interfering health problems. About 5 years ago, the Institute of Medicine, through the National Institute of Health here in the United States, changed these recommendations, recommending women begin breast imaging at age 50, do it only every other year, and stop in the 70s. This has been very, very controversial with women's advocacy groups, and up until recently, the American Cancer Society still sticking to the original recommendations.
But lately they changed it.
The American Cancer Society is recommending starting at age 45, but you can start earlier based on discussions between the woman and her physician. It is of concern to us because we begin to see more and more breast cancer as women get into their 40s. And this is an age group that's very important to protect. These women are mothers of young children or children who are still financially and emotionally dependent on them, very productive in their careers, responsible for their families. So it's an important group that we need to protect strongly.
But U.S. Task Force still recommends different ways, right? This is only for American Cancer Society. U.S. Task Force did not change their recommendation, what age we should start.
No, the task force recommendations came, as I said, came about 5 years ago, and until they changed them, this is still their recommendations. And as I said, these have not been picked up widely. You know,
so what age group then women say, okay, I should not have any more tests? Is there an age group that we should tell our patients to say, well, that's enough, or actually breast cancer continues all age groups and then until late age?
It continues through all age groups. And I have women in their 90s who are still going for routine mammography. And I have women in their 90s who are being treated for breast cancer. But it becomes really an issue of other competing health interests.
Now, when we order mammogram now, we are ordering ultrasound at the same time. So we're saying diagnostic bilateral mammogram and bilateral ultrasound. Can you explain all that for us?
So while mammography is a good screening test, it's not perfect. And it can miss in younger women about 15% of breast cancers. So we are using in women who have denser breasts ultrasound as a second study to improve the sensitivity of the testing. New York State was the first state to pass a law requiring that women be informed about breast density and the possible use of ultrasound. About 3 or 4 years ago, New Jersey and Connecticut then followed suit.
Okay. So what is the recommendation now for our patients to say self-breast examination?
This again has become a very controversial issue. For many years, women were very strongly encouraged to do breast self-exam, and many women found it very challenging and nerve-wracking. It made women very nervous. Not every breast feels the same. Many normal breasts are lumpy, bumpy. So it became very hard for women to be able to do this. There were a number of studies that came out, one very large study in China a couple of years ago, and then a Norwegian study that showed no impact of breast self-exam. There's no benefit.
So how often they should be examined by their physician?
Starting at age 20, every 3 years by primary care provider, either their pediatrician, their GYN or their internist, after age 40, yearly physical exams by their primary care provider. Yeah.
And now we know that if there's no risk factor, just for screening purposes only, the American Cancer Society recommends to start at age 45.
After discussion with, with the physician.
With the physicians, right. What are the risk factors that for these women that they might have higher chance of having breast cancer?
One risk factor is family history. So if you have a first-degree relative, a mother, a sister, a child with breast cancer, this probably doubles to triples your breast cancer risk lifelong. Risk becomes much higher if the relative was diagnosed with premenopausal breast cancer. Lifestyle issues are very important, and a big issue and a big challenge for us here in the United States: obesity, lack of exercise, heavy alcohol use, and all of these. Smoking, not as strong a risk factor.
But alcohol is definitely.
But alcohol, very much so. Right. There's also very good evidence that cardiac exercise, doing some cardio 3 times a week, and it doesn't have to be a lot, it can be 15 minutes, reduces breast cancer risk. And it's thought that this happens due to transmitters that are released from the muscle and fat during exercise. And we see a decrease not only in breast cancer risk, but other cancers as well. So lifestyle issues are very, very important in terms of prevention.
So mammogram result comes in and says some calcification is seen, and radiology usually love to say that.
Right.
Calcification, not important or important. So what do you do as a surgeon when you get that kind of report saying that there's a calcification in the breast?
Well, there's different kinds of calcifications, and some are clearly benign, and some are unclear. And it's the unclear ones that cause problems, because 85% of those are not cancerous or precancerous. And the problem is not with the X-ray, the problem is with us, because we can't distinguish who's in the 85% who's fine and who's in the 15% who's not fine.
Right.
So those patients, we usually recommend they get a image-guided needle biopsy. Not a surgical biopsy, but have the areas sampled or tested under X-ray.
Thank you, Dr. Guth. Now we are out of time. Now we will continue our conversation in second part.
Okay, thank you so much.
Now it's time for this week's article. It is fish oil and muscle mass. In older adults, age-associated declines in muscle mass and muscle function are major risk factors for an impaired ability to carry out activity of daily living, falls, prolonged recovery after hospitalization, and mortality. Therefore, the preservation of muscle mass is critical for the prevention of physical decline and mobility disability. During the middle age, muscle mass begins to decline at a rate of 10% every decade, which negatively affects muscle strength and muscle power. Regular physical activity, including resistive exercise and adequate protein intake, are important in maintenance of muscle mass. Some studies conducted in cancer prevention and patients with rheumatoid arthritis suggested that omega-3 fish oil can stimulate muscle growth and enhance muscle strength. Recently, a study supported by INH evaluated the efficacy of omega-3 fish oil therapy to slow down the age-related loss of muscle mass and muscle function. Healthy 60 to 85-year-old men and women were assigned to receive omega-3 fish oil, 2 gram, or corn oil for 6 months. Muscle volume, hand grip strength, lower and upper body strength were evaluated before and after treatment. Compared with the corn oil group, omega-3 fish oil therapy increased muscle volume, hand grip strength, and increased leg exercise power. Omega-3 fish oil therapy slows the normal decline in muscle mass and muscle function and should be considered a therapeutic approach to prevent muscle loss in older adults. Since after middle age we all lose muscle mass, we should take omega-3 fish oil supplement and eat fish several times a week and do resistive exercise to prevent muscle loss. Good health is precious and priceless. Pay attention to your health and keep informed by visiting AAHPO's website, aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, so long.